A very good afternoon to one and all. Today's topic is Meniere's disease. It is also called as endolymphatic hydrops. It is discovered by a French doctor, Prosper Meniere, and it is having uh, excessive distension of endolymphatic system of the inner ear. It's a major problem of the Meniere's disease. It is a classical triad: vertigo, tinnitus, and hearing loss. It is a classical triad. It's called as Meniere's disease. Is okay. Coming into the, you all know that the functional utility of the inner ear. There is a semicircular conus, bony labyrinth, and membranous labyrinth. It's according to that bony labyrinth, membrane, the circulations, the electrolytes within present in the semicircular conus is that it has to be properly balanced. Then only you can able to maintain a proper equilibrium of the electronic imbalance as well as the protective action of entire inner ear. Okay, as well as for the communication purpose also. Okay, you all know that this is a picture. Okay, this Meniere's disease is concerned with, we have seeing a blue color. This distended is entirely distended due to the blockage of the endolymphatic system. This entire endolymphatic system has been enlarged so that it directly compresses the vestibulocochlear nerve, which is responsible for the proper hearing. Okay, due to that entire distension of that fluid collection, it is called as collection of a pocket. So it is called as hydrops. It occurs in the endolymphatic system. It is called as endolymphatic hydrops. Okay, more commonly males are affected, mostly unilateral. The sensory neural deafness is the commonest presentation. Then coming into the etiology, there is no proper clear-cut etiology. It is a some kind of theories has been formulated. There is a defective absorption of the endolymphatic system. It results in this kind of disease condition. Then imbalance, this ionic imbalance which occurs in the semicircular canals, it can result in the Meniere's disease. Okay. Then various autoimmune disorders and hypothyroidism, mumps, syphilis, chronically inflamed diseases, and severe head trauma can result in the Meniere's disease. We have categorized the various process which has been involved in the Meniere's disease. You can go through in this PowerPoint. You can able to understand that. And this is the pathology. This is obstruction of the endolymphatic system results in the production of total endolymph secretion as well as reabsorption. So it results in a severe distension of the endolymphatic sac. Due to that distension, it causes increased pressure as well as it results in rupture of the internal membranes, which results in the vertigo, tinnitus, and hearing loss. This is the classical triad of Meniere's disease. You can able to see it's a normal membrane. Okay, again this bluish color, it shows the endolymphatic circulation. Here you can able to see the endolymphatic system has been distended. Okay, the clinical features is episodic vertigo. This sudden onset it can occur daytime and nighttime, anywhere, anytime, any location. Okay, in the time, what will happen? Patient will not able to understand the situation very clearly. They will lose his consciousness as well as hearing loss also. Again, he comes back to the normal because this imbalance which occurs semicircular is not permanent. So it immediately comes back to the normal secretion. That's why patient can come to the normal position. This fluctuating hearing loss. In that vertigo time period, patient is not able to hear it properly. That is also a major problem. Tinnitus is a humming sound. You all know that. The other features are very less important. Headache, pain, discomfort, nausea, vomiting. Some cases is getting more predominant. Then uncontrollable eye movements, especially this nystagmus. This rapid oscillatory eye movement is called as nystagmus. As you all know, already I explained in this various tests, audiological tests in the class, Weber's test and Rennie's test. This test has been and has to be done in this patient because whether you have to know whether this patient is suffering from Meniere's disease or some other conditions. You have to know. You have to load the possibilities of middle ear as well as the external ear disease conditions. Otoscope audiometry and electrocochleography and calorie tests has to be done. In advanced cases, MRI and CT scans also has to be done. You can able to see in severe cases cochlear widening and vestibular aqueducts has been malformed. Okay, uh, even though there is a more collection, if there is any deformity in this draining port area, so it can result in more distension of the fluid. Okay, more amount of fluid is getting collected within the endolymphatic sac. That is a major core problem of Meniere's disease. Then management, we have to make a decompression, surgical management decompression of this endolymphatic sac, possible way of getting drained out the excessive fluid. That's all about the Meniere's disease. Now coming into the acute mastocytitis, it is one of the complication of acute suppurative otitis media. It is inflammation of the mucosal lining of mastoid air cells along with the communicative system of the mastoid antrum. It results in severe bony erosion as well as the destruction of entire mastoid bone, so that we can patient is not able to touch the ear or backside. That is, especially this mastoid bone, especially is not able to touch it. You can able to see the pointer structure is a mastoid swelling. You can able to see due to that accumulation of more amount of fluid is not able to lift the ear pin. That is a more characteristic of acute mastocytitis. Then routine investigations, complete blood routine. In X-ray of mastoid, it shows indicates a destruction of this mastoid bone. You can able to see it here. The differential diagnosis is separation of mastoid lymph nodes, furunculosis, that is inflammation of the hair follicles of the meatus. Then infected sebaceous cyst can be maybe one of the differential diagnoses for this acute mastocytitis. We have to go for the myringotomy and cortical mastoidectomy in case of acute mastocytitis in severe cases. Okay, that's all about the various. Then once the infection is extending beyond the sternocleidoid muscle, then it results in the abscess formation within the sternocleidoid muscle. It is called as bezold abscess. Then one more abscess, then extension is somewhat anterior aspect. It is called as entering into the zygomatous arch. It is called as zygomatic abscess. Then some portion, sometimes it may extend into the post-auricular region between the sulcus, post-auricular groove, it can extend. That is as a post-auricular abscess. These are the various complications can result in the acute mastocytitis. Okay, that's all about it. It can be treated antibiotically. Patient can easily recover. That's all about acute mastocytitis. Thank you.